Hi, I'm Dr. Anna Toker. We're going to talk today about fillers in our Consent Corner. And we're doing it today in an open space that needs filling. This is one day going to be our spa. I figured it was an appropriate location to talk about the topic. In particular, we're going to discuss hyaluronic fillers. What are they? Why do we use them? And what could possibly go wrong with their use? First of all, hyaluronic acid is a normal protein found in the skin. It is responsible for the hydration appearance of the skin, and it tends to be in high quantities in younger people. So skin with lots of hyaluronic acid looks like young skin. We use this in medicine in an injectable form to fill spaces in the face that hollow out with age. And we use it because we know it to be safe and because it's a temporary effect. In other words, if you don't like it, give it some time, it'll go away. You can put hyaluronic directly onto the skin with a process called an intraceuticals oxygen facial, and that will be one of our other talks some other time. But today we're talking about the injectable version of a filler. Now, a filler is not like Botox. We've talked in another consent video about how Botox relaxes muscles and softens the appearance of some wrinkles that are in motion. A filler, on the other hand, gives rejuvenation or a fullness to hollow spaces. And so by doing that, you can alter some of the aging process and bring back more youthful appearance. So my face is, I'm 50, so this is a perfect example. So a young person will have almost a triangular face. As we get older, we lose fat, and I don't know if you can see in this dark space, but we lose fat sort of here around the cheeks. We lose fat sort of in a hollow space about right here and here. We lose fat in the temporal area, and when that happens, the face then turns up from this upside down triangle to a right side up triangle. So when the lower half of your face starts to become the base of the triangle, you look older. That's a feature of older people. The purpose of the filler then would be to try to refill those spaces that you have lost due to age, to try to recreate the upside down triangle. That's all we're doing with the filler. It has to be injected, and because it has to be injected, it requires a visit to see me as the physician. Although I don't do a lot of these injections personally, we let our aesthetic nurse do those, and she will take very good care of you. Part of the process of your education and consent is watching this video. So the fillers are injected into a hollow space to recreate emptiness that was brought to you by your age. The most common place to put it actually is around the lips, and even young people will do this to give the lips a little bit more plump fullness. And some of that thinness of the lips is age, and some of it's genetics. Some people just don't have I'm kind of a thin lip person myself. So when we inject this medicine, it is for the purpose of giving a plumpness, a fullness, or to fill a hollow space. What could possibly go wrong, right? So when we do that, the most obvious thing that could go wrong is maybe you don't like the way that it looks. It's our policy here to do less, especially on the first visit, to make sure that you're happy with what you see. You can always put more in. It's a little harder to take the stuff out. And so we start at a lower dose. And that's the first thing to know, that your first visit, if you've never met us before, we're going to be very conservative, and that is for your safety and for your happiness. The second thing that could potentially go wrong is because this substance, it is dissolvable by your body, but it has volume to it, and that volume can cause pressure. And there's certain structures in your face that don't like pressure. Blood vessels would be one of those things, and nerves would be another one of those things. So we have to be very cautious with injecting these substances around blood vessels and nerves. If a patient were to experience symptoms related to pressure, we can immediately dissolve the substance with an enzyme. And so we do not do these injections unless we have the reversal agent immediately available, and that again is for your safety. If you're having this compression-like symptom, it becomes obvious very rapidly. However, after this procedure, if for some reason you're having a negative response to it, pain or a skin discoloration, you have to let us know. So that's an emergency phone call to us, and if we need to reverse the process, we can do that with an injection. We typically will tell people, don't love it or hate it for a couple of weeks. So there's going to be a follow-up for you in a couple of weeks to meet with Nurse Tanya. And so she's in charge of doing the injections, adding some filler if you don't like it. If you have an emergency, between me and her injecting the area with our reversal agent to get rid of it if we have to. All right, so that's what hyaluronic acid is, a normal substance found normally in skin that gives your skin volume. The second thing is how we get it in there. We inject it. And the third thing is, how do we get it out of there if there's a complication? We inject a different substance. Okay, so that's fillers in a nutshell, and enjoy your plump lips.